A new Catholic health care program gets support from two prominent American clergy members. Wyatt Goolsby has more on this alternative to Obamacare.
Brian, it's called CMF CURO. It's not insurance, it's the country's first Catholic health sharing ministry. Since the nonprofit launched in January, it's seen steady growth, but today they got an official endorsement from Cardinal Raymond Burke in Rome and Bishop Earl Boyer in Lansing, Michigan. Those endorsements came this afternoon during an international teleconference in Washington. Cardinal Burke says he's an advisor to the program. Since it's launched in January, CMF CURO is serving nearly 400 households and has members in over 40 states. Cardinal Burke says CMF CURO could provide an alternative option to Obamacare and is consistent with church teaching.
We find today that this freedom to carry out the care of the sick, especially the care of the needy, in accord with a well-formed conscience, is being more and more challenged. And that's why a work like CMF CURO is so important, to provide the way in which this kind of care can continue to be given.
CMF CURO is running their program with Samaritan Ministries International, which has been providing health care sharing to different Christian groups for years. Because CMF CURO is not insurance, they do not have to comply with mandates from Obamacare, which means members' monthly payments do not pay for abortion-inducing drugs or contraception. Brian?
Thanks, Wyatt. David Wilson is co-founder of CMF CURO, Catholic Health Ministry. Why did you start the ministry, David?
CMF CURO is a Catholic health care sharing experience, Brian, and it provides Catholics that are very concerned about their faith a real option to participate in a health care program that is consistent with their faith. We're doing so in partnership with Samaritan Ministries International, which is a long-time healthcare sharing ministry.
What is the significance of Cardinal Burke becoming one of your advisors?
Well, as you know, Cardinal Burke is a very holy and thoughtful man. He is a great advisor. We've had a long relationship with Cardinal Burke for many years, since the foundation of the Christ Medicus Foundation itself, that is really the author of the CMF CURO program.
So members of your group who subscribe to this are expected to refrain from smoking, from excessive drinking. Why is that?
Well, this is a Christian sharing ministry. This is the idea that I am dedicating myself to my faith, and I'm going to care for directly for the needs of the members themselves.
Does that not also make them a better risk?
Well, sure, certainly it does. If you're going to church every week, which is a requirement of the program, you are not participating in lifestyle situations that would be necessarily detrimental to your health. So, no, this is a healthier population of people than the general population. That would be a true statement.
Do you check up on them? How do you confirm that they're living up to the expectations?
Well, to qualify for the program, you have to have your pastor or another member of the parish testify that you are a weekly participant in Mass and you're a part of the parish. And so we can't check up on everybody. Clearly, we're all sinners, Brian. And but the intention is that I'm serious about my faith. These are things that I'm committed to doing. I want to participate in true Christ-centered ministry to my brothers and sisters in Christ that are in need of health care.
So really the idea is it's a heart thing. I mean, you have people that want to be a part of this because of who they are.
Absolutely. This is a spiritual ministry. It's not insurance. It's very important that we communicate to all that this is a ministry in which the members directly take responsibility in Christ-centered Christian sharing for each other's healthcare burdens. And that's very, very important. You have to really say, look, this is part of who I am. It's my self-identity that I'm Catholic, that I'm Christian, and I want to care directly for other members of the ministry. And it's really a commitment. It's a vocation.
It would seem that God would bless an effort like that. It'll be interesting to see how successful you're able to be. David Wilson, CMF CURO, Catholic Health Ministry. Good luck and thank you for joining us.
Well, God bless you and thank you.
Thank you.